Hi, my name is Alicia Woodyard, and I'll be doing this presentation on adolescent health. Sensation seeking. Sensation seeking is a desire to experience increased levels of arousal, such as those that accompany fast driving or the highs associated with drugs. This leads to recklessness, which in turn leads to increased rates of accidents and injuries in this age range. To reduce the number of accidents in this age range, many states have enacted establishing graduated driver's license. These risky behaviors may be more common in adolescence because they help teenagers gain peer acceptance and autonomy with respect to parents and other authority figures. Teens with the highest sensation-seeking behaviors are strongly influenced by media portrayals of risky behavior, such as sex, drugs, alcohol use, and violence. Drugs, alcohol, and tobacco. Illicit drug use is far less common than it has been in the past due to the understanding of the consequences of using drugs. Drug use still continues to be a problem as it still exposes teens to risks such as lifelong drug addiction. Alcohol is the substance of choice for most teens. Some of the factors that influence teens to use drugs, tobacco, and alcohol are sensation-seeking, peer pressure, and their parents' parenting style. Each day in the U.S., about 2,000 youth under 18 years of age smoke their first cigarette, and more than 300 youth under 18 years of age become daily cigarette smokers. Eating disorders. An eating disorder is a mental illness in which the person's eating habits go far beyond regular dieting. They are far more common in girls and those that are gay, lesbian, or questioning their sexuality. These disorders tend to make their appearance in mid to late teenage years. A good preventative measure against eating disorders is to promote a healthy body image to teenagers. Anorexia nervosa. It is characterized as extreme dieting, intense fear of gaining weight, and obsessive exercising. Teens with this disorder will have a more distorted body image than teens with bulimia. Anorexia nervosa can be fatal, with suicide being the most common cause of death, followed by physical complications of self-starvation. 20% of people with anorexia will die without treatment. Only 1 in 10 people with these eating disorders will receive treatment. The average onset of anorexia is age 17. This picture shows how anorexia affects the whole body. In the brain and nerves, it causes you to not be able to think right. You have a constant fear of gaining weight, irritability, and moodiness. It affects your brain, your memory. Can cause fainting and changes in the brain chemistry. In the hair, it causes the hair to get very thin and brittle due to lack of nutrients. In the heart, it can cause low blood pressure, slow heart rate, heart palpitations, and in severe cases, heart failure. In the blood, it causes anemia and can cause other blood problems. The muscles and joints, it can cause weak muscles, swollen joints, fractures, early onset osteoporosis. In the kidneys, it can cause kidney stones and, in severe cases, kidney failure. It causes low potassium, magnesium, and sodium. In the intestines, it can cause constipation and bloating. In hormones, in women, it can cause periods to stop, bone loss, problems growing, trouble getting pregnant. If you get pregnant, it carries a higher risk for miscarriage, having a C-section, and having a baby with a low birth weight. It can also cause postpartum depression. With the skin, it causes you to bruise easily. Skin's very dry, get cold easily. It can cause jaundice, which is yellowing of the skin. And it can cause your nails to get brittle. This is a photo of a woman with anorexia nervosa on the more severe side of it. Bulimia nervosa. This disorder involves an intense concern about weight combined with twice weekly or more frequent cycles of binge eating followed by purging. These teens are not extremely thin but do have obsessive behavior about their weight and often experience depression. 34% of people with this disorder also self-harm. There is an increased suicide rate in people with bulimia nervosa. Bulimia nervosa has a higher chance of being a lifelong struggle in Latinos and African Americans. This graph shows how bulimia nervosa affects your whole body. The brain, it can cause depression, fear of gaining weight, anxiety, dizziness, shame, and low self-esteem. It can cause swelling and soreness in your cheeks due to purging or mainly throwing up. It can cause cavities, tooth enamel erosion, gum disease, and sensitivity to cold and hot foods with your teeth in the mouth. Can cause the throat and esophagus to become sore, irritated, and it can cause it to tear and rupture. It can also cause blood in your vomit. Causes you to be fatigued. In the stomach, it can have ulcers, pain, can cause your stomach to rupture, and delaying emptying of the stomach. On the skin, it can cause abrasion of knuckles and dry skin. The blood, it can cause anemia in the heart. Irregular heartbeat can weaken the heart muscle. Severe cases, it causes heart failure and low pulse and low blood pressure. It can cause dehydration and low potassium, magnesium, and sodium. Constipation, irregular bowel movements, bloating, diarrhea, and abdominal cramping in the intestines. And as for hormones, it can cause irregular or absent periods. Depression. Depression is a mental health issue that causes persistent feelings of sadness and loss of interest in activities. Brain chemistry, hormones, inherited traits, and childhood trauma can all cause depression. Family history of depression and other mental health problems can also be a factor. It may hinder academic achievement because it interferes with memory. At any time, 5% of teens are going through a bout of depression. Suicide. 16% of teens have thought about committing suicide, and 8% have actually attempted it. Suicide attempts are more common among girls, but boys are more likely to be successful at completing the act. Major risk factors for suicide are having a psychiatric disorder such as depression, a serious loss, bullying, and struggling with sexual orientation. There are about 5,400 suicide attempts by teens in grades 7 through 12 every day in the U.S. It is the third leading cause of death in youth between the ages of 10 and 24. Bullied children and teens are more than twice as likely to attempt suicide. These are my references, 2 pages of them.